right.
Welcome back to the office.
So
Let
this,
me give you a little tour as we walk through our waiting room, obviously. And this is our kids area. We see people of all ages. Some of our youngest are infants, and so we always have a fun place for them to play if they have to wait or if their parents are getting adjusted. And then, I don't know, do you remember me telling you about BJ and Dee Dee Palmer?
I do.
This is the founder of Chiropractic, and Chiropractic actually just had its 130th birthday in the United States. So September 18th, 1895, the first chiropractic adjustment was performed by Dee Dee Palmer, and at the time he was we call a magnetic healer. Was some of his interest. It was looking into ways of helping the body heal naturally. And he was studying the spine and nervous system, and his janitor, this is in Davenport, Iowa, was deaf. He had been deaf for something like 17, 18 years after an injury to his back, lost all of his hearing.
Wow.
And he performed the first chiropractic adjustment, and his hearing was restored. And so initially he thought chiropractic care was going to be a cure for hearing issues, and what it's turned out to be is a lot more than that. And it's really about restoring nerve system communication from the brain to the rest of the body. So issues from potentially hearing sometimes to migraines and blood pressure issues and back and neck pain and issues down the extremities. I mean, you name it, we've seen improvement with that. And so that's where it all started.
Awesome.
And you can come with me this way. So our adjusting bays are here. So this is where we actually perform the chiropractic adjustment. And we have a computer monitor in each room where we can see the person's x-rays as we're adjusting them so that we can be as specific as possible to them. And then we have functional testing in our office. We do metabolomics testing, which will show us any vitamin or mineral deficiencies in the body. We can give specific protocols based on what people are actually deficient in. To functional GI stool tests so that we can assess the microbiome of the gut and help heal that, which is at a root cause of a lot of health issues. Genetic testing, hormone testing, and then we carry top tier supplements that are organic. They come from regenerative farms, and we have protocols for patients using these top level supplements to help address deficiencies in the body. And then this is our warm-up and rehab area. So our patients do specific spinal warm-ups before their adjustments. And then after the adjustments, our patients wear specific weighting based on their own individual x-rays. And then they stand on these vibrating platforms here so that they get neuromuscular re-education, which helps them hold their alignment and adjustment longer.
Absolutely. So we will actually have an interview with Dr. Keene here shortly where she will go more in depth about chiropractic and what it is. So stay tuned with Champion for the Stress, and we'll have that interview shortly.
Sure.
All right, hello, I am Arius with Champion the Stress here, and I am having the honor today to sit down with Dr. Kelsey Keene of Keene Chiropractics, located here in Austin, Texas. Dr. Keene is a personal favorite of mine, so that's why it's an honor for me to do this interview. Champion the Stress, of course, is a blog that focuses on, helping the everyday adult relieve stress. In last week's blog post, we talked about acupuncture and the benefits of acupuncture. I personally can attest to the benefits of chiropractic because this is a clinic that I've spent a lot of time in with a lot of benefits. So I'm actually going to let Dr. Keene talk to us about what chiropractic is and what benefits there are. And the special thing about her is she's a max living facility. And so I'm going to let her discuss what that is also, because I've noticed a difference in that versus what most people's experience is with chiropractic.
Thank you for having me. I like talking about stress for a few reasons. One, it disrupts people's health, and it is a known contributor to major health issues. And so if we can address reasons that people are experiencing so much stress, then their health is going to improve. And so you mentioned Max Living Health Center. We're one of hundreds of Max Living Health Centers across the U.S., and our focus, our healthcare delivery system, if you will, is the 5 essentials of health. And so I always say there are 5 essentials, not suggestions, to good health. And that is through corrective chiropractic care, which is our essential number 1, quality nutrition. And so we have nutrition plans for each of our patients. Maximizing oxygen and lean muscle we teach metabolic conditioning type exercises. Minimizing toxicity is number 4, and then number 5 is right in alignment with what we're talking about, which is stress reduction. We call it maximize mind. I like to say peace management versus stress reduction. So focus on the thing that you want the most, which is more peace in our life. And chiropractic actually has a big connection with stress. It helps people's body with stress in multiple ways. Did I make you sit up straight?
Look, as I noticed I was slumping, I said.
So when it comes to stress, through improvement in our stress through chiropractic care, there's a few main reasons. One is helping with tension in the body and our muscles. So that relieving that through specific chiropractic adjustments can make a difference in the way people's body is experiencing stress. The one that I'm the biggest fan of is balancing the autonomic nervous system. So if you go way back to like junior high school science, biology, we learned that our body has an autonomic nervous system, and it's split into 2 divisions.
Such a big word.
Our sympathetic nervous system, which is often called fight or flight, and then you have the parasympathetic nervous system, which often is referred to as rest and digest. Now, most people who are under a lot of stress, it's because their body is stuck in a sympathetic dominance, and that can happen from experiencing emotional stress, stress with your job, stress with driving to your job in Austin traffic. All those things can make your body put into sympathetic dominance. So, and the interesting thing with stress is that our body doesn't know the difference between stress from, financial situation we're in, or terrible drivers in Austin, or the reason why our body has those stress responses, which would be like a survival situation, like being chased by a tiger. And so for a lot of us, our nervous system feels like we're being chased by a tiger all the time, and we're stuck in very sympathetic dominance. And research shows us that when you're adjusted, it balances the difference between the parasympathetic and the sympathetic nervous system. So we're able to increase our parasympathetic dominance to get us out of that fight or flight. And so that's, in my opinion, like the magic of chiropractic, is getting that improvement. And there's ways we can test that, like testing people's heart rate variability and seeing improvement after getting a series of adjustments. Other ways is decreasing pain. So if you are stuck in pain, this has a effect on our body, makes us our body feel more stress, have a lower threshold for stress and those pain. And then sleep. Probably the most common feedback to someone's very first adjustment is noticing that they sleep better and more deeply, fall asleep more easily. And so if we just even focused on getting more sleep, we would be experiencing stress in a lesser way also. But
And there was one thing I remembered that fascinated me most with my experience with Dr. King. She did a nerve assessment, right, in my first visit. And I remember, like, my nerves were, like, black, right? I didn't know what that meant. But, like, it's color-coded, right? And so, background with me is I have cerebral palsy. So mine is neuromuscular, right? And the impact that I saw from having, I think I was here for about 6 months, and the amazing impact that we saw in that was being able to sleep, the stress relief. We saw like where my pelvis was kind of tilted at 6 degrees, and we got it down to where it was like a 2 or 3 pelvic tilt, and how much difference that made, and Dr. King's nutritional method I still use to this day, and my body like immediately triggers when I step outside of that. She has literally taken us to the grocery store, like a big field trip, and walked us through, Sprouts, and, showed us how, these are the top 10 foods you might want in organic, like bell peppers, bananas, things like that. How to break ice cream, utilizing yogurt to break that craving of ice cream, and grass-fed beef, and, all of those things to help your body detox, like she mentioned before, So as not just an interviewer for Champion with Distress, but also a patient of hers, I have been able to see the difference in her versus, you know, the traditional chiropractor that just adjust, done. You know, I don't want to name drop any other places, so I'm not going to. But I have been to some places that they do those in-out adjustments and treat you like an airport, and her system is not like that. You know, you're given a package that, you know, you have a thing to sit on that keeps you moving throughout the day so that your back muscles don't get stiff. She gives you things to help with that C alignment, the nutrition assessment. The first thing upon entry I noticed was the packet that talks about all your goals and dreams and your aspirations, and, you know, I guess trying to get your mindset in the alignment to be able to be receptive of, you know, the treatment that she possesses. And so, you know, with a name like Champion Distress, she definitely, you know, has the you know how to help you do just that, Champion Distress. So I guess my one question to you is, how much does a typical chiropractic visit cost, and how does someone get started, you know, in this journey?
The getting started part is important. You were mentioning some of the things that are different about our office and our approach to this, and I think it starts with the examination. And this is where sometimes people are looking for something like a fast food type of chiropractic experience where very little of an exam is done, and just, you know, the goal is just to make things pop and crack, right? And that's not truly a real adjustment that's removing a spinal subluxation. And so the assessment is everything. In our office, x-rays are really important. So we take digital x-rays of the spine prior to giving a first adjustment, because that's how we analyze what's happening in the spine. Also, I've seen crazy things on x-rays where, thank God I took them, and so I could give a safer adjustment and avoid specific areas that were not, you know, going to be good to adjust. And so we take those x-rays and then we analyze the alignment and structure of the spine, because there is a specific structure to the spine that everyone should have that makes it biomechanically effective and correct. And so then we create an adjusting protocol, as well as very specific home exercises like you were talking about with the wobble seat, other exercises to address the muscles and ligaments that hold the spine together, so that we can get as much structural correction on those x-rays through that series of care. And then as far as typical costs, once you get past that initial evaluation and any imaging testing that might need to be done, the average chiropractic adjustment in this area is probably somewhere between $50 to $80 a visit, depending on what therapies you may do with that adjustment. And then some offices like ours create programs to make corrective care and the number of visits that are necessary more accessible and affordable for people. So at least in our office, if somebody is on a treatment plan that they're committed to, the majority of their visits can go down as low as $38 a visit, which is really underpriced. But we have a real mission to change healthcare in the Austin area, and one of the ways we're doing that is just to address any financial challenges people may have to getting their care.
Absolutely. One thing that I did notice was exactly that. I mean, I had just moved here to Austin, had joined Dr. King's practice. So I moved to Austin, I had joined Dr. King's practice, and you know, she changed my whole outlook on it. And still to this day, like, my whole outlook has changed on it. And there have been times I've moved all over since. I've moved to Arizona, everything, and I have not found anyone that has the same treatment that she does. And that's kind of where I honed in on that max living, you know, and I'm like, that's what makes her stand out from everyone else, because her approach is a more structural approach, like she mentioned, versus just snap by, you know. And, you know, it was about 3 to 6 months, I think, with Dr. King, and the amount of progression in that, you know, has made such a difference, especially for a condition like mine, being cerebral palsy, where there's no treatment, there's no cure, no one knows how to help you, You know, you go to the doctor, you ask them for something, and he's just like, whatever. If you want it, you can have it, because there's nothing there. You know, so having a personal condition like mine, there's nothing there. And I think one thing that led me to Dr. King was how emotional like she was to me as a patient. You know, when she sat down and discussed with me my nerves being black, you know, she got very emotional, because she's like, you're not in pain, like you're smiling, and you know, and she's like, you don't feel any pain, you know, and she broke down that chart, you know, to me, of where your nerves should be and things like that. And so you know, I should have been in pain apparently with having black on there, but you know, having a condition like this, you've gotten so used to that. And the thing that I noticed with chiropractic is that I didn't realize I was in pain until she got me out of pain. And then you start noticing things like, wow, I see different. I'm sleeping better. This part of my body feels different than it did before, you know. And so our bodies learn to compensate, and we don't realize that they're compensating. And like I mentioned before, we don't know that. I didn't know I was in pain until I wasn't in pain. And so now that awareness is there when I'm not where I should be. So you know, my biggest recommendation is, if you are in this area, you know, check out Dr. King. I'd say that's the first go-to. You know, if you're not in this area, then I recommend looking for a Max Living Chiropractic, or even reaching out to her and seeing if she has some recommendations. And you know, I'll include like her phone number or email or something, so that you're able to reach out to her and see how to go from there.
Can I also include where people could find their closest Max Living?
Absolutely.
Yes, you can go to maxliving.com. You can learn more about our healthcare approach, as well as find a doc in the top right corner and put in your zip code, and you'll see the closest Max Living doctor to you. And then just reach out to them. If you are on the fence a little bit, just have a consult, tour their office, see what they have to offer, and see if it's a good fit for you, between you and that doctor.
Absolutely. And she can be found at www.keenchiropractic.com, or is it a different?
KeenFamilyChiro.com.
See, totally different. King Family Chiropractic.
K-E-N family, and then just Chiro, CHIRO.com.
Absolutely. So I will put her information down below and how to reach her. And we want to thank you so much for taking the honor to work with Champion the Stress.
Thank you.
Thank you.
It's been fun.